Hi, and welcome to Labor Views Nova Scotia. I'm Danny Kavanagh, the host of the weekly show here on local community radio at CIOE 97.5. Today I'm talking with Tammy Findlay. Tammy is a professor and chair at the Department of Political and Canadian Studies. Before joining Mount St. Vincent University faculty, Dr. Findlay taught at the University, York University, Trent University, and the University of Western Ontario in political science, women's studies, social science, and Canadian studies. She has also worked as a policy researcher for a national social policy organization. And we have also with us today Christine Saulnier. Christine is the director of the Canadian Centre for Policy Alternatives Nova Scotia. She is a doctorate in political science from York University. Many listeners will know Christine as she leads the living wage calculations for communities across Atlantic Canada and serves as a co-author of the annual Child and Family Poverty Report Cards for Nova Scotia. She has written extensively and given commentary on various public policy issues, including fiscal policy, labor markets, and of course, childcare policy. Welcome, ladies, and I'm pleased you're joining me today to talk about public childcare and getting to $10 a day childcare in Nova Scotia and why it's so important for so many. Maybe we'll start with can you tell us a little about yourself and what you're working on today, or maybe anything that I may have missed in your introduction? So whoever wants to go first and jump in.
I can go first. It's Tammy. Thanks, Danny, for the introduction. Because in addition to what you've already said in your remarks at the beginning, I am the past president of the Canadian Research Institute for the Advancement of Women. And I've written quite a lot with Christine, working with the Canadian Centre for Policy Alternatives Nova Scotia on early learning and childcare.
And hello, all. This is Christine. And I guess I would add one thing in that I also am on the steering committee of Childcare Nova Scotia, which is an organization that actually is advocating for a public childcare system in Nova Scotia. And, I'm actually working on a little piece responding to the federal government's announcement about further investment into childcare. So there's lots going on and lots to talk about. Thanks for the invitation.
No, it certainly is. And childcare is a huge issue, I know, here in Nova Scotia. So what are the benefits of affordable $10 a day childcare in Nova Scotia?
That's a big question. There are lots of benefits. Maybe before I get into that, I'll just say something about the words $10 a day childcare, because I think we're going to spend our time together going into that in a lot of detail. And I just wanted to note that when we talk about $10 a day childcare, it really is a catch-all for a lot more than just $10 a day. It's about a universal public system. So that includes affordability, but it also includes many other really essential elements for childcare, including universality, high quality care, having a comprehensive system that has a range of other services in addition to childcare that supports families, and that really exists within a national and a provincial policy framework that allows for sustainable funding and for really developing a system in a planned and an intentional way. So when we think about what are the benefits of this kind of system, I think one of the important points we want to talk about right away is that this new system really addresses three challenges that Christine and I and other childcare advocates have written about for a long time. It addresses challenges around wages, fees, and spaces. So the wages of our primarily female-dominated childcare workforce, the very high fees that parents pay for childcare, and of course we'll talk more about that as we go along, and then the lack of spaces, the lack of regulated childcare spaces for families. So the benefits are really about moving us forward on those three key areas.
Sure. Now, Christine, do you want to add to that?
Well, I actually really wanted to focus in next on sort of the benefits. When we think about childcare, of course, we're centering children and families together. But we wanted to underline that when we're building the system, what we want to ensure is that it is a high quality system. And then to ensure the quality, we really want to make sure that we have well-trained and well-compensated educators at the center, and that we're building a system that's play-based curriculum. These are not kids sitting at desks. These are little ones who are being engaged by these incredibly well-trained early childhood educators. And then you really see the benefits flow out for children.
No, absolutely. So let's dig a little deeper into a bit around that. So how does affordable childcare contribute to the children's well-being and development?
I might actually start with talking about personal experiences, in that I have 3 children, and it's been 20 years, maybe a little less than 20 years of a span where I've had children in incredibly wonderful childcare. And when I think about the experiences that we had as a family, that those wonderful experiences for our children had to do with those early childhood educators, and the way that they are able to build relationships with those children, the way that they engage them at such a young age. It's such a critical time. They're so little, their neurons are just bursting, and they're engaged in so many different ways, from art, creativity, to science, to critical thinking in that young age. I remember they would, show us pictures at the end of the day of everything that our children would do. They'd have constant conversations with them. They were such a part of our support as parents, learning how to support children when they're so young in terms of their learning, and understanding their different styles of learning, but also helping them to socialize, helping them to really be ready for school. And it's those early childhood educators that are sort of the first ones that might identify any issues with children and really do that early intervention. But I would really underline, that play-based curriculum that they have, and those educators really support our children from social, emotional, physical, cognitive development, in addition to what we think of in terms of, school readiness. And so, I couldn't say enough about the experiences that my children had with their caregivers and our family, and how important it was in terms of supporting them as they moved on to the next stage of their lives.
No, absolutely. You raise some very important points, I think, about the well-being and development. And you touched on something that I like to talk about a while. It's critical thinking, and we just don't need to see that in our kids, but some adults could use some critical thinking skills as well. So
Absolutely.
how does affordable childcare impact parents and their ability to work and pursue an education? Tammy, do you want to touch on that?
Sure. Again, it's really crucial to parents and their ability to work or to pursue education. It allows parents to make choices about their working hours. So many parents are working part-time, especially moms are working part-time when they would prefer to work full-time, but they choose those hours because of their childcare needs. And so having affordable and reliable quality childcare allows parents to make decisions to work full-time, for instance, if that's what they prefer. We also know that there is an immense gender impact in terms of fostering ability to work or pursue education. Hopefully we'll have more time to unpack that as we talk today. Childcare also allows parents flexibility in the location of their work or their education. So they just have more choices in terms of where they choose to work or study. It is a huge stress reliever, and I hope we can talk more about that later as well. Finding quality childcare is a major concern for parents, and so allowing them to have these options really reduces that stress that they are always experiencing.
For sure, and it's really important. When people want to pursue extra education, we see announcements in healthcare where they want people to move from one sector of the healthcare system to become nurses. Whether they move up as CCAs, and their ability for a lot of them to do that stuff is really important. But it's really important that they have a place where their kids can go and have that childcare that they need. So
Christine and I were both involved in a project a few years ago called Changing Public Services. And in that project, we had discussions with a range of groups in the province, and one of them was with nurses. And we assumed when we met with nurses that we would hear a lot about their challenges around working in the healthcare system. But one of the most frequent comments we got from them was about the lack of childcare and how that was making their jobs very difficult. So I think your point is exactly right, Danny, that there are particular challenges that occur in workplaces when parents can't find reliable childcare.
no, for sure. Christine, how does $10 a day childcare support low-income families in Nova Scotia?
Well, it would be really critical that we get to a place where we have $10 a day. I mean, kudos to the government. So far, we've reduced fees in Nova Scotia by 50%, but that's only for those who get access to the licensed regulated care. And of course, that's not all families. We'll talk a little bit more about the lack of childcare in our province. But for those families who are lucky enough to get access to the system currently, if they are low income, they do get access to a subsidy system as well. So there is some subsidy to support them. But what I really want to underline is that we need to build a universal system. That means childcare should be accessible to everyone, regardless of their income, regardless of their cultural or linguistic circumstances or ability or where they live, whether their parents are working or studying, or whether their parents are nurses and working non-standard. Like that, we build a system that not only supports our low-income families, but actually supports all families. Of course, as Tammy talked about, childcare is critical. If we make it affordable, it's possible for those families to actually either join the workforce or increase the number of hours that they're working. If childcare becomes affordable, then it's not that trade-off that happens so often now, where families have to make a decision about, well, you go into work and you're working minimum wage and most of your wages goes to childcare. You'd rather be at home with your children. You make that choice. Also, maybe you can't even get access to childcare. So it would make a big difference for families, all families. But $10 a day is actually likely too expensive for our low-income families. Ideally, I think we want to get somewhere where we have free childcare for everyone. Why is it that we only have it once you turn a certain age? Through elementary and secondary, but that this is part of our early learning education and childcare continuum, and that it should be available to everyone so that we directly fund and build this system. The subsidy system doesn't work well. And of course, it's just an add-on to what is a really patchwork market-based system that has a lot of uncertainty for families. Are they lucky enough to get access? If they get access, are they in a center where if it's for profit, you don't know what might happen? They might close the doors next week. Like there's such uncertainty for families, no matter what income level they're at, to be able to access childcare. And for all our families, they just want to be able to access something that's responds to their needs, that's close to home, that really is good quality programming. And so it absolutely would be, as they say, a game changer for all families in Nova Scotia to get affordable access, but for low income families would make an incredible difference for those children.
No, it sure would. So we have to take our first break. It's a very interesting discussion. You're listening to Labour Views Nova Scotia. I'm the host of Labour Views, Danny Kavanagh, and we're talking today to Tammy Findlay and Christine Saulnier about childcare in the province of Nova Scotia, and we'll be right back after this short break. Hi, everybody, and welcome back to Labour Views Nova Scotia. Today, we're talking with Tammy Findlay and Christine Saulnier about childcare here in Nova Scotia, public childcare. So Tammy, what evidence exists to demonstrate the positive effects of affordable childcare on children and their educational outcome?
There's a lot of evidence about the impact on children's educational outcomes. So I did a postdoctoral fellowship at a center in British Columbia called the Human Early Learning Partnership. And one of the key focal points of that center is to look at a tool called the Early Development Instrument, the EDI. And the EDI is used to try to get an understanding of how prepared children are to transition into school. And it looks at a number of factors. So it doesn't look at school readiness in a very narrow way. It's quite holistic. It tries to understand where children are in terms of their physical health and well-being, their social competence, their emotional maturity, their language and cognitive development, their communication skills, and general knowledge. And what's really interesting about this instrument, and we use it in Canada and they have data about it in Australia as well, is that public early learning and childcare is a major factor in seeing children develop on all these domains. So I think that's just one example of the evidence we have that really tells us that there's a clear link between having quality public early learning and childcare and supporting children in their education.
No, all important points, and lots of research to demonstrate the positive effects that affordable childcare has on our kids. Christine, do you want to talk a little about how affordable childcare helps, reduce income equality in Nova Scotia in particular?
Absolutely. I mean, it's important as a province that we think about the problem of income inequality, which, is measured by really looking at what the difference is, what the gap is between sort of the top 10% and the bottom 10%. There are different ways of looking at it. But that gap in inequality is something that we want to narrow, because we want to live in a province where we actually share in the growth that exists. And when we think about the role that childcare plays, it plays a couple of different roles, both on the income and obviously on the cost side when we make it affordable. On the income side, when we think about income inequality, a part of what's feeding that inequality really are low wages. So whether that's a low minimum wage or the disparities for low wage workers, including our ECEs. They're some of our lowest paid workers in our economy. If we build a system, and we must build a system that really values this work, it means increasing wages of a significant group of low-wage workers and ensuring that they're fairly compensated. So we think about the fact that this work, which has always been considered sort of women's work, quote unquote, and unskilled, that we actually value that work for what it is. They have educational credentials, that this is skilled work, and that we make sure that their wages are not eroded by inflation. So on that side of the income scale, we bring up some low wage workers, but also that we think about, in terms of paying for this system, redistributing income from the top, making sure our taxes are more progressive, so those who can afford to pay more actually pay more. And we use that additional revenue to provide public services, including childcare, which at the end of the day decreases out-of-pocket expenses, which is another way that we think about, how do we address that income inequality? And when I think about the cost side, it's a significant cost for families. Again, for those who are lucky enough to get access, they're still paying $400, $500 or more a month. If they get access to the licensed care, they're paying way more than that if they're in the private market. When I calculate the living wage budget, childcare makes up about 18% of that budget, and it's actually equal to the amount that families spend on food. It's a really significant expense. So if we can think about it on both those sides, providing childcare supports families as well to have better access to the labor force, which also increases their household income, which is the other way that we can get at income inequality. But it's about more than just tackling income inequality. And I think maybe Tammy, you want to add a little bit, because there are other forms of inequality that childcare also can support us tackling.
Yeah, thanks, Christine. So one of the other elements of inequality where childcare is significant is addressing something that we sometimes call in social policy the motherhood tax. And this really looks at inequality among women. So we often think about gender inequality when we're thinking about economic inequality as the difference between the earnings of women as compared to men, but we haven't spent enough time thinking about the role of motherhood in determining women's economic inequality. And so we know we have this phenomenon called the motherhood tax, which really brings in two of the things Christine talked about. It relates to both income and costs. We know that being a mom, being a parent, but especially for women, being a parent affects income. We've already talked about how it affects hours of work and choices around work. And then there are also high costs, high childcare costs associated with being a parent. So we know that in addition to there being a large gap in income between women and men, there is actually a very large gap, not only between men and women who have children, but between women who have children and women who do not have children. So even if we think about Christine and I as an example, Christine has children, I don't have children. And so the income and costs differences between our situations are quite large. And so a public childcare system is a really important way to address that inequality, that structural inequality that comes along with being a parent.
No, for sure. There's a lot for people to unpack there and to start and maybe think a bit differently about childcare and their needs around childcare in the province and what it really means to them to be able to have a universal public system that's affordable. I think is really on point, and it's something that we can strive to get and we can get, and some of us have all been working for a long time around the subject matter, so it's really important, right? And it's really important that we continue to educate people about some of the key points. The reverse of the income equality and stuff, though, are the long-term economic benefits of having a $10 a day childcare in the province, a system that's universal, public, affordable kind of childcare in the province. What do you want to touch on, the economic benefits of having such a system?
Yeah, I will jump in. Indeed, some of us have been doing this work and thinking about how to make the case for childcare for a very long time. And while we would want to think that making a case for childcare based on the evidence in terms of children and the impact on children and their well-being should be enough, we also now have compelling evidence that building a childcare system like this that is universal and accessible and affordable is actually a proven economic development strategy. It offers substantial economic returns. As we've been talking about, access to childcare not only helps and we're talking about women because the stats show us that women still provide by far a majority of unpaid caregiving in the home. And that includes, of course, childcare. And it enables women to be able to enter the workforce to actually do less of that unpaid childcare should they choose to want to enter the workforce. And so in doing that, it can increase their employment and their earnings. And of course, by increasing their employment and their earnings, that increases the revenue that governments also collect, of course, because of income tax. But it also could support parents, either parents or both parents, to be able to participate in education and training opportunities. So also increasing their education and training. That's all about productivity. If we are supporting people to reach and contribute to their potential, it's good for the economy, it's good for economic growth, and we have lots of different numbers. I'll give you one. If we invest every dollar that we invest in childcare, the growth in GDP is about $2.30. I could compare that to many other things, and childcare outpaces so much. In terms of economic benefits, because it has such benefits for children's learning and development, and we are investing as early as possible, we are reducing social costs because we're preventing adverse outcomes. We're supporting those children early on. And of course, the earlier you invest, the bigger your return on investment. If you're catching up later, we all know that that would cost more. So we're actually looking at an economic benefit there as well. And in terms of the increased revenue to government, in fact, the research is showing us that universal high quality public childcare ultimately pays for itself. So not only is there an estimate that for every dollar that we invest, there's $7 in return in economic benefits. So not just the economic growth piece, but broader economic benefits, but that what happens in terms of the labor market participation and increase in productivity and increase in revenue actually means, and we've seen this in particular from Quebec, who's had a $10 a day childcare or an affordable childcare system for much longer than the rest of Canada, that the system itself pays for itself. So very compelling evidence on the economic benefits.
I can remember years back, when I was doing some work on childcare, we had a report commissioned by a person out of the University of Toronto, particular in about Nova Scotia and childcare. And I can't remember the individual's name that did the report for us when I was president of CUPE back at the time. But to your point, Christine, back then he was estimating in his final report that he gave us about the large increase in GDP for the province of Nova Scotia. And that stuff I think is really important when we can raise a GDP in the province and people understand what that actually means for the economic benefits of the province is a really important aspect. So that's a really great point, I think, around that. So anyway, we're up to our time that we have to take a break again. So we've been talking to Christine Saulnier and Tammy Findlay about childcare and the benefits of having a public, affordable, universal public childcare system here in Nova Scotia. And we'll be right back after the break. Hi, and welcome back to Labour Views Nova Scotia. I'm the host of Labour Views, Danny Kavanagh, and with me are Christine Saulnier and Tammy Findlay, and we're talking about public childcare here in Nova Scotia. So, Christine, do you want to talk about some of the challenges and barriers that might arise with $10 a day public childcare here in Nova Scotia?
Yes, I think what we really want to underline is that we're talking about transforming how childcare is provided in the province, going from this market-based patchwork approach where parents are lucky if there happens to be childcare in their community, to one where we have a full early learning and childcare system that can be accessed by anyone who requires it across the province, and building that system in order for us to ensure that we're using the funding as efficiently as possible and making it responsive to parents. We need that system to be public. We need that commitment up front that this will be a nonprofit system, and that it will be built with what was actually promised in the bilateral agreement between Nova Scotia and the federal government when it was signed back in June 2021. And that was that the province would set up a central agency that would be an independent body that would systematically plan for the system. This wouldn't be about current, overworked, understaffed nonprofits responding to an expression of interest, saying whether they can expand their spaces, figuring that piece out, putting that on their shoulders, but it actually would be really led by the central agency that would be funded to do this work, to have the data, to know where the needs are, what kind of needs parents have, and that would be the body that would provide the block funding. We would no longer rely on parent fees. So a complete re-envisioning of that system. And obviously that kind of transformation takes very careful implementation. And a key part of the challenge currently is that we have a shortage of ECEs, so early childhood educators. And without early childhood educators, we do not have childcare spaces. We do not have childcare. And we really need to be investing more in supporting them. This is an undervalued workforce, as we've been talking about. And we really need to be retaining the early childhood educators that are in the system, and we are losing them and are at risk of losing more unless we address their wages and compensation. The province did develop a wage grid, but the wage grid, the lowest wage on that grid is $19.67 an hour, and the highest wage on that grid, so that's for early childhood educators level 3 with 5+ years of experience. The highest they can make on this grid is $25 an hour. $23.50 is what I've calculated as a living wage in Halifax, and that puts those wages into perspective. We're really not rewarding those ECEs who have been in the system for a very long time. And this is just wages. They also deserve compensation in terms of benefits, defined pension plan, being able to have health benefits. That's a significant barrier right now, is the retention of those ECEs and then the recruitment of new ones. And then another barrier is that we really do want to make sure that those fees are affordable. $10 a day, again, is affordable for most people and is a significant reduction from what people are paying currently. But it's still not, it's still not free, which arguably it should be, but it definitely should be free for those who are on low income. And while it may be easy to implement that in a sense, that is, our government can actually provide the funding to replace the parent fees. We want to make sure that that's done in a way that it's equitable across the province, that people actually do get access. And so that other piece is obviously that expansion. You retain, you recruit ECEs, you make sure that the system is affordable, if not free, and you make it available. And those are all significant barriers, but they can be overcome should there be enough funding in the system and enough systematic planning.
Absolutely, and it's an important aspect because you can't have, without workers, you can't have childcare. So without childcare workers, you can't have childcare. So, the government needs to step up to the plate now and start and look after those people to keep them in the system as they, expand the childcare spaces across the province. So, Tammy, how does the availability of affordable childcare impact the mental health and well-being of parents?
Well, finding safe, secure, affordable childcare is really stressful. We hear a lot of talk about the social determinants of health. But you know what? It turns out that providing secure care for families is actually an excellent mental health strategy. Otherwise, they face juggling childcare and work, dealing with the precarious patchwork, cobbling together solutions that families have coordinated in order to meet their everyday childcare needs, working on shifts with family and friends. I was thinking about when I was a kid, both of my parents worked in factories. And when I used the idea of cobbling together, that's exactly what they did. So my parents tried to work alternate shifts. We would go to our neighbors at 6 o'clock in the morning before school. We'd have a teenager come after school. And so there were all these, and this would happen in the summer too. So there were all these kind of makeshift arrangements that had to be made. And I can just imagine how stressful that was for my parents. And I'm sure Christine has experienced similar things as well.
Well, that's a story that I'm sure many parents can relate to, Tammy. I definitely can. I was thinking back to when I had my first child, and I was actually in grad school, and obviously could not afford full-time childcare in Toronto. That's where I was doing my graduate work, and we did find a space initially, and then couldn't afford it and begged for part-time. It's very hard to find part-time care because there's such a demand for care. Most spaces are full-time. Eventually, we just cobbled things together. We hired our fellow grad students at one point. We did different shifts as parents. We did everything we could. And even, we moved to Halifax, and our second child, we could not find that childcare spot when we needed it, when our parental leave was done. So we had to take some unpaid care for quite a while, I think 3 or 6 months actually. And then, sometimes we had to actually make choices that would not have been our first choice in terms of childcare. And we were never, ever able to access Francophone care. So that's, I think, something that we want to also make sure that the system is responding to the needs in the community. And, finally, our children did get into incredible nonprofit childcare centers with unionized workers, and the care was incredible. It's so wonderful that, in fact, I held my third child back, who was born in December, for another year of childcare because it was in my community. Like, I could walk there. I knew how wonderful it was. And so I was privileged at that point. We were able to make a decision to continue in this wonderful childcare place we were in. And it was, I can't say enough about when you actually do have quality childcare, how important it is for us as parents, and then of course our kids. So yes, totally relate to those stories.
No, and it's important, and it's fortunate that you had that luxury in your community, but a lot of people don't have that same luxury right now across the province, and that's why we all support looking to get the universal affordable public childcare in the province, so everybody can have that kind of access that they need. It's a huge stress reliever, and it's there's a lot of stress on those that are parents with young children that need childcare. So, what steps can be taken to ensure that childcare providers are adequately compensated while maintaining affordable fees? So, Christine, do you want to talk a little about how that works?
Yes, and I would go back to my previous answer around this central agency that we've been talking about. But really what we want to underline is we want to actually take the parent fees out, in the sense, even if there's people, what's currently on the table is $10 a day. So even if we want parents to pay that $10 a day, we actually want to break that relationship between parents paying the fees to the childcare centers, and the childcare centers then figuring out all of that, and having to apply for different blocks of funding here and there, and actually have maybe through the tax system, I'm sure we can figure this out, where parents actually pay fees to a different body, and then the revenue is given to the centers, kind of much like the public education system, where we make sure that the centers have enough to pay their early childhood educators enough to compensate them fairly, as I've outlined, to ensure that we are looking at their education and experience and the value that they bring, and that then we just make sure that we have a public system that's appropriately and properly funded. That's really the only way forward. And as I say, if we're not going to retain those ECEs and then recruit more with the compensation packages that are required, then we just don't have childcare, affordable or not. It just won't be in our communities. And so that's the only way forward.
So, Tammy, how does $10 a day childcare support, including children with diverse backgrounds, and all kids have different abilities for sure, to ensure affordable childcare is accessible to families from those diverse cultural and linguistic backgrounds here in the province of Nova Scotia?
Yeah, this is a really important question. And I think I would first say it doesn't automatically support inclusion. So we have to be really intentional about how we design childcare to ensure that it actually does advance inclusion, which is one of the key benefits of a well-designed childcare system. If it's designed well, it allows opportunities for children to interact together. It allows them to experience different kinds of communities. We know that there are possibilities around advancing inclusion if we diversify the workforce, if we have a thought out plan for addressing environmental racism, including where quality services are located, if it is designed that in ways that respect the principle of Indigenous self-governance. And so there are lots of there's lots of potential to advance inclusion, but as I said, it has to be done in an intentional way. If we think about public services, we have to acknowledge that not everyone has the same relationship with the public sector, right? The legacy of residential schools, for example, means that Indigenous communities have an understandable mistrust in public institutions. And so it requires developing services that, for instance, consider the Truth and Reconciliation Commission and other insights we have from Aboriginal knowledge keepers. We also know that there's an opportunity to create child services that address the heavy reliance we have on private services, including migrant workers. So we have the opportunity to create not only a diverse workforce, but one that does not rely on the heavy exploitation of migrant workers. One of the things we wrote about when the Ivany report came out several years ago was a response to the notion that about what we can do to develop the economy in Nova Scotia. And so we talked about in that piece that what we really need are public services that attract and then retain immigrants. And we know that childcare is essential. It's essential for immigrants in all communities, but especially in rural communities. We also have to ensure, though, that those services create welcoming spaces. We need to have culturally competent trained workforce that create places where children with diverse backgrounds can interact and learn about differences. We really need a plan for where we develop services. That is key to inclusion. It's key to inclusion around, as I said, racial diversity, for example, but it's also key to questions around socioeconomic status. We need to have services that are also inclusive in terms of LGBTQ to IA plus communities, and we need services that are designed to address all the needs of all children.
No, for sure, and you make some excellent points, Tammy. We got to take another short break, and we'll be right back in a few minutes. Hi, and welcome back to Labour Views. Today we're talking about public childcare here in Nova Scotia with Christine Saulnier and Tammy Findlay. Christine, do you want to talk about what strategies can be implemented to address the shortage of childcare spaces in Nova Scotia?
Yes, I mean, the number one strategy is obviously funding it appropriately so that we can actually expand the spaces. And with the bilateral agreement, there was a little over 600 million from the federal government that was put into that bilateral, another 40 million from the Nova Scotia government. So that is a start. And what their promise is with that funding is to reach a place where 59%, there's childcare for 59% of children in the province. So, they're not going for 100%. Arguably, it's not 100% of families who would want their children in childcare, but 59% seems rather low when we consider the percentage of parents, including mothers with young children who are actually in the workforce. And so that likely is a target that needs to, what that's telling us is they will have to continue to increase the funding and figure out what that coverage rate is as they plan forward. That actually represents 9,500 additional spaces for children under 6. Yet what we know is that 47% of young children in Nova Scotia actually live in a childcare desert, and that's with the CCPA report that was released just a few weeks ago. That means nearly half of the children and families in the province are not able to access licensed childcare spaces, and that varies a little bit across the province. And the most deserts we see, the most lack of spaces, shall we say, is absolutely in the rural areas of the province, where we need obviously additional funding. We need to figure out the infrastructure piece, and that may require more funding. So funding is the number one way forward for us to be able to make sure that we have a system that responds to the need in the community. And obviously that needs to fund our ECEs appropriately again.
Tammy, how can affordable childcare help alleviate the financial stress on families? You want to touch on that a bit?
I think, Christine, maybe you want to talk about that one.
Yes, I can. And this is really about the economics of what this means for families. I've been looking at these numbers for 6 years very closely since we've been doing the living wage calculations. And childcare is such a significant expense for families. We're still looking at families paying somewhere between $800 to $1,000 for childcare. And that's likely if they're in the unlicensed private care space, given what I just underlined in terms of how many licensed spaces are provided. That means that parents are still paying significantly. Now, for those who got the 50% cut, that is significant. And if we get to $10 a day, that will be down to somewhere like $200 a month. So from 1,000 to 200 is a significant relief for families that have been paying childcare or that are looking to what might be next in terms of their family and in terms of paying. And as we talked about, getting access to that childcare also could allow parents, especially women, to move from part-time to full-time, or actually even just move into the workforce and increase their family income. So both sides of that equation are impacted by affordable childcare.
So, Tammy, what role does our community and the community's involvement play in the success of building a $10 a day childcare initiative here in Nova Scotia?
Yes, so community involvement is absolutely essential. It should be community that decides where new spaces will be located, how wages will be set, the timing of services, when they will be provided. But we also need to think about who is community when we talk about community. We often have a different understanding of community than what we might see from governments, right? So community involves parents, but it also involves unions who are not always engaged with adequately by public engagement processes. It involves researchers. It involves those who advocate for a public system. They have been the primary advocates for childcare for over 40 years, and their voices are key to this conversation. We think back to many of the references Christine's made to the central agency. They could play a key role in organizing the public engagement aspect, the really essential public engagement aspect of this system building. We have been really lucky in the last 2 years to have a new voice in Childcare Now, province-wide early learning and childcare coalition, who have played a really important role in advocating for the system before and while it's unfolding. We need to remember that $10 a day, the slogan $10 a day, didn't come from government. It's not an idea that government came up with. It came from childcare advocates. It came from childcare advocates in British Columbia. And then the idea has been adopted nationally. This speaks, I think, to the importance of the knowledge, expertise, and activism that's in the community. The idea came from the community, and it's up to the community to make sure that it's implemented in a way that it was intended.
No, for sure, and that's everybody has a role to play, right? We can all work together to make our communities much better places, and when everybody has a little bit to say around many things, including this, which is so important for so many workers, so many families from all across the province. So, what measures can ensure that $10 a day childcare services are accessible in rural communities? Now, I know a lot of times childcare is maybe more familiar in some of the larger communities and some of the larger cities and towns and those kinds of things. So, Christine, do you want to touch on that about the concern, or is there any concern about accessibility for rural communities?
Oh, there definitely is. That same CCPA report that looked at where childcare was provided, a licensed childcare in the province, underlined that 61% of children in rural areas are living in childcare deserts. So they're either in an area where they would have to travel quite far and possibly into the next region over to access childcare, or they're in an area where they're going to have to figure out unlicensed options. So 61% is very significant, and it's twice as hard to find childcare in rural than some of our more urban areas. It definitely varies, but I think what it's underlining is the role of public infrastructure and why we need that funding to make sure that we're building childcare in those communities where we can't just no longer put it on volunteer shoulders to figure out where a new childcare center might go, but that we actually fund it appropriately. And we might need to be creative. Maybe we think about the hub systems where we bring together different community resources in a childcare center, and we're able to, answer to other community needs at the same time, because we know that childcare isn't the only thing that's lacking in our rural communities, but absolutely it's a challenge. And I think we can meet that challenge.
So, how can affordable childcare support the integration of the newcomers and immigrants into our society? So we know we're welcoming new immigrants here all the time. Every province we see are ramping that kind of work up. So, Tammy, do you want to touch on that?
Sure. I think one of the important ways goes back to something Christine talked about earlier, which is the sense of community that's created for families who use childcare centers. I mean, I've heard stories about people who still are in contact with their early childhood educator 30 years ago, right? They've become part of their extended family. And so a childcare center can provide support for newcomer families. So a kind of social support that they can rely on with connections to other parents, but also with the staff at the center. It creates connections to community that are really important for newcomers. We also know, just given what we've already said, that childcare provides access to the labor force. It makes life more affordable. It addresses unpaid caregiving. All of these are especially important for women and for newcomer women in particular. And we also know that current system or lack of system operate, immigrant and racialized childcare workers are concentrated in the less formalized and more precarious forms of childcare. So I think as we can develop a public system of childcare, we will also be addressing the working conditions for newcomers to Canada.
No, very, very important aspect. So Christine, I know you talked a little about some of this stuff, but what role can early childhood education play in breaking the cycle of poverty that we have in this province? We know family and child poverty is higher in Nova Scotia than it is in a lot of the other provinces. Do you want to touch on that in a bit broader strokes?
Yes, childcare is definitely one of the essential services that we need in order to break the cycle of poverty. One of the other reports that I write and publish through my organization, CCPA, is the Child and Family Poverty Report Card every year. So I'm very familiar with these numbers. We have about 21% of children under the age of 6 who live in poverty, according to the last data that we have. And 18% of all children under the age of 18, that's 31,000 children in Nova Scotia who live in poverty. I want to focus on those early younger children. We know actually that the poverty rates are highest for children who are under the age of 2. And what I want to underline is that childcare is essential because of what we've been talking about. If it's affordable or free, then we can support families and children in terms of the early intervention for the young children, also for parents. So it's affordable to them. They can increase their income. It might allow them to go back to education. So you're increasing earnings along the way as well. What we underline is that child and family poverty is first and foremost about providing income. We need to be addressing the income side of poverty, obviously, first and foremost, but not only. If people are still left finding childcare in the market where we don't have public nonprofit childcare that's outside of the market that is affordable, then they will be struggling. We provide them with income on one hand, and it just goes out the door for these expensive services on the other, whether that's childcare or housing or other things. We need to provide some things out of the market, and childcare is one. It should not be a business. It should be affordable and available to everyone. We shouldn't have to worry about whether our childcare closes its doors, as maybe a convenience store might around the corner. This is an essential service. We need to make sure that it's available. We know that childcare is essential for breaking that cycle of poverty, but not just. And we've talked a little bit about this. We also need to address that flexible, more generous maternity, parental, and paternity leave. We need to have more pregnancy supports, parenting supports, flexible working arrangements, got to address those higher wages and better working conditions. And as I say, affordable housing. It all goes together, and childcare is a very critical piece of that package.
So Tammy, as we wind down a little now here, how can the government collaborate with community organizations to create a sustainable $10 childcare system here in the province?
Danny, I'm glad we're ending with this question because I do think it's the fundamental question that we have to grapple with. For instance, in Nova Scotia, we have an innovation the engagement table that was created to help assist with the rollout of the childcare system here is unique. It doesn't exist in other places. And so I think we should think about the importance of that table, but also think about how we can make better use of it. It really has a lot of potential. It could create regular opportunities to meet with community and a broader idea of community that I talked about before. And I think advocacy coalitions that represent many voices in the province, like Childcare Now, are essential to be part of the ongoing conversation about how this system develops. I think another really important aspect, if we want community to have a real say and a real voice in public policy, we have to provide funding. We need public funding for advocacy organizations to be able to fully engage in this important conversation.
No, I couldn't agree more. And anyway, that brings us to the end of today's program. I want to thank you both very much for coming on today. You've provided, our listeners with a lot of insight and education about, universal public childcare, $10 a day, childcare here in the province of Nova Scotia. You both have, are experts in the field as far as I'm concerned, and many other people. And you've been working at this for a very, very long time. And kudos to you both for the work that you do around making this become a reality. We're a long way from where we were 15 or 20 years ago, and that's because of the work that people like you guys do and many others across the country as well. I'd also like to thank Ron James, our producer here at 97.5 CIOE, your local community radio station, who makes this show possible every Tuesday at noon. Join us then and hear lots more about labor views and the different guests that we'll entertain over the coming weeks, talking about lots of different issues that are important to many workers and the public here in Nova Scotia. So again, Tammy and Christine, thanks a lot for coming on, and it's been a wonderful conversation.
Thank you, Dan.
Thanks.